taught me is don't confuse people. So let me tell you, all we would do with this bill really is set up an authority to hire a consultant to figure out for us what would our insurance plan look like if we organized our state as a cooperative, where the state, the people who invested in it, meaning all of you, would have, the only person the cooperative would be beholden to are the people who own it, which are its citizens. And what we would do is hire a consultant. Those of you who've been following some national health care reform know some other states have done this. Vermont comes to mind. And given the parameters of the system that are described in the bill, tell us what it is the system could provide and what it would cost each and every one of us. And then the legislature would have the opportunity to look at that and say, this is a good idea, let's refer it to the ballot, or it's not a good idea, we won't refer it to the ballot, although if citizens wanted to do it anyway, they could go for a citizens initiative. So really all we're doing is designing a blueprint and an implementation plan. But the bottom line goals of the system are that it include everybody and utilize some of the new cutting-edge things that have been shown to decrease cost and improve lives. Patient-centered medical homes, accountable care organizations, community-based health, focusing on health care and not disease care. Because if you design health care right, you don't need so many people to be in the hospital and you don't need as much expensive medical care. And that's what we're going to try and do here in Colorado. I thank you for coming out to this press conference. I am going to be in Legislative Services Building A, which is across the street here to the south, to talk about Senate Bill 168 and what it does. And in addition, for those of you who are interested in some of the health policy behind it, to talk about some of the parameters that are in there that I hope will lead to a more economical, socially just, and financially viable situation of health in our great state. Thank you.
Questions?
Everybody, we do have time to take some questions from the press. So if there are questions from the press for any of the speakers, please bring them now. There will certainly be people available afterwards and across the street for additional questions. Thanks. Any questions?
So the cooperative.
Yeah.